Hello everyone. Welcome to NSN's YouTube channel National Skills Network. We hope you all are doing well and keeping safe. Today, me, Sahitya, and my colleague Pratyusha, we are going to talk to you all about a very important industry sector today, that is healthcare. Today, healthcare industry is one of the most critical industries across the globe. With millions of cases and increasing number of deaths, India is among the hardest hit nations during the second wave of coronavirus pandemic. There is a need for strong healthcare ecosystem and a potentially skilled workforce are needed to deal with healthcare issues we are facing as a country. Building a strong healthcare workforce by investing in skill training, reskilling, upskilling is the need of the hour.
Over the years, the healthcare sector has become one of India's largest sectors, both in terms of revenue and employment. The size of the industry is estimated to reach 372 billion USD by 2022. Despite some challenges, the healthcare industry in India showed resilience in times of crisis and tried to address the demands of growing disease spread. Health professionals act as a critical point of contact and in continuing care for patients, helping to ensure treatment is appropriate and adaptive to patients' needs. Doctors, nurses, and caregivers are essential to high quality primary care delivery, which can help halt problems before specialty care is needed, saving resources, time, and cost.
Healthcare industry in India challenges in scaling. Every crisis comes with an opportunity, and so is COVID-19 pandemic for the healthcare industry. COVID-19 is an opportunity on which we need to act now. So, what are the points and what are the current challenges that the healthcare industry in India is facing today? Infrastructure development, shortage of skilled professionals, rural urban disparity, adoption of technology, strengthening of public healthcare. Infrastructure development. Infrastructure development is one of the most critical challenges that healthcare industry in India is currently facing. The healthcare infrastructure in India right now is not enough to cater to the masses in the country. The infrastructure is often underfinanced and short-staffed. Lack of medical infrastructure, including adequate number of life-saving ventilators, had posed a major question over India's ability to tackle the COVID-19 crisis. Shortage of trained professionals. Shortage of trained healthcare workers and professionals had severe repercussions on health access and has severely affected the country's COVID-19 response in the initial stages. India has one physician for every 1,404 people and 1.7 nurses per thousand people, according to the Ministry of Health and Family Welfare. But this is far below the benchmark of WHO, that is World Health Organization, which stipulates one doctor and three nurses per thousand people. This calls for the need to skill and train many more people in the healthcare sector. Rural-urban disparity is another challenge that healthcare industry faces. India's healthcare professionals are majorly concentrated in the urban areas. This makes availability of healthcare in rural, remote, and underserved areas more challenging. Strengthening public healthcare. The public sector offers healthcare at low cost or no cost, but it is often perceived as being unreliable or of different quality, and generally it is not the first choice unless one cannot afford the private hospital. Therefore, sufficient policy interventions are needed to strengthen the public healthcare.
In-demand job roles in the healthcare industry. The healthcare industry will continue to grow even in the future. The need for healthcare services has increased, so is the demand for skilled healthcare workers. Since the pandemic has increased the scope of opportunities in the health sector, the ministry is working with individual countries to work out equivalence of qualifications. MSDE has identified 3 lakh jobs in the health sector alone in countries such as Australia, Germany, Canada, Japan, Sweden, and Singapore. Among all the job roles, there are few in-demand job roles which we'll tell you about. So the most in-demand job roles are attendants, care workers, lab technicians, hospital staff, among others. These were some of the most in demand job roles in the healthcare sector today. Apart from these job roles, other blue and grey collar jobs for skilled workers have also been identified in a dozen odd countries, including the Gulf, United States, Singapore, and Switzerland. Officials expect 2.63 million job opportunities in the Gulf countries in the next 5 years.
Now let us look at the impact of technology and the current trends. What the pandemic has shown us is that at least 30 to 40% of doctor visits can be replaced by video consultation. This is now an accepted norm by both patients and doctors. Video consultations lead to a greater access to appropriate, accountable, timely, and also affordable outpatient care for the patients. This will decrease the cost of providing care for the doctors and hospitals by reducing the costs of infrastructure and manpower. Technology in healthcare has been there since the day the first x ray was done. What is new is the purpose for which it is being used now. Major disruptive technologies like artificial intelligence, machine learning, Internet of Things, data science, and robotics are moving digital health to a whole new level. Technology has helped both central government and state governments in coming up with robust responses in tackling the pandemic. This includes setting up of dedicated COVID-19 hospitals, isolation centers, and technology-enabled mapping of resources. The Indian government also leveraged technology and developed various applications like Arogya Setu mobile app, which assisted in syndromic mapping, contact tracing, and self-assessment. It was widely used throughout the country. Such technology platforms were used to supplement the response management, which included delivery of essential items in containment zones, teleconsultation with patients, bed management, and real time monitoring and review by the authorities. Digitization has also helped in transforming healthcare, doctor consultation, diagnosis, treatment, drug discovery, and research. Let us now look at the current trends in the healthcare industry. The current trends are telehealth, telemedicine, and virtual care, increased demand of data, and AI driven, that is, artificial intelligence driven predictive analysis, artificial intelligence, Internet of Things, and smart cities, which will lead to digitalization in public sector. The future of healthcare lies in closely working with the technology. The healthcare workers must embrace these emerging technologies to stay relevant now and in the future. After the pandemic, governments and organizations are more focused towards building a digital infrastructure and preventive healthcare.
Now let us look at some of the most essential skills which you will be needing to launch a career in the healthcare sector. Today, the deficit of skilled manpower remain one of the major challenges in strengthening the healthcare infrastructure. To address the skill gap, the Union Ministry of Health and Family Welfare is going to establish 140 skill centers in government medical colleges across the country to impart skills of life-saving interventions. Now, let us look at the 5 must-have skills to launch a career in the healthcare industry. So, let us start with the most crucial skill, which is communication skill. So, as a part of the healthcare industry, you'll have to interact with many people on a everyday basis. So, your communication skill has to be on point. Apart from communication, you will also have to be a team player, and you will also have to work in a team. So you must have the teamwork skill. Apart from this, you will also have to manage your time efficiently. Manage your time efficiently. And coming to stress management skill, in today's scenario, when we all are going through a tough time because of the pandemic, managing stress is a very crucial skill to have. Apart from all these skills, flexibility is another crucial skill which a healthcare professional must have. To strengthen the healthcare environment and to provide skilled manpower to the industry, there are various initiatives from the government. The establishment of the Ministry of Ayush and the Healthcare Sector Skill Council were a part of those initiatives. So now let us look at the Healthcare Sector Skill Council and what are the key objectives of the Sector Skill Council. So the key objective of the Healthcare Sector Skill Council is to create a robust and vibrant ecosystem for quality vocational education and skill development in allied healthcare space in the country. So Healthcare Sector Skill Council is responsible to provide continuous skill development to those who wants to be a part of the healthcare industry. So coming to the Ministry of Ayush, the Ministry of Ayush, otherwise known as the Ministry of Ayurveda, Yoga, Naturopathy, Unani, Siddha, Soya Rigappa, and Homeopathy, is proposed to develop education, research, and propagation of indigenous alternative medicine system in India. There is a sense of urgency to recruit and upskill India's healthcare workforce, and it will take a PPP ecosystem with central and state government institutions, hospitals, medtech, edtech, non-government organizations, and corporate India to collaboratively address the demand and supply inequality and social injustice. So these initiatives from the government will definitely help in bridging the skill gap in the healthcare industry. If you wish to build a career in the healthcare industry, then you can choose from the wide range of job roles that are available. However, to do so, you must first build the required skill set. With this, we have come to the end of our presentation. If you found our presentation on the skills, training, and career in the healthcare industry useful, then please share it with your friends and family. Thank you so much for watching our video. Before signing off, we would like to remind you to subscribe to our YouTube channel if you haven't subscribed it already, and do not forget to press the bell icon next to it to never miss an update from us. We'll see you in our next video.